Okay, Herb, you and I, we're starting this new news roundup and we're going to get right into it today. So we're going to pick 6 or 8 topics that you and I think are newsworthy over the last few weeks and hit on that and just give a real quick debrief so that everybody can get up to speed like you and I are.
It's just the facts today. I
Just the
like it.
facts. All right. Well, hey, what's the first one we're going to talk about today?
Yeah, first one, in July, CMS introduced or proposed its new 2025 physician fee schedule.
Mhm.
And like prior years, there's a decrease in the conversion factor that's used to calculate Medicare rates and for services physicians provide to Medicare beneficiaries. And this is kind of the continuation of a long story of these decreases get proposed, and then we'll see if Congress comes in and makes a change and staves off some of the cuts. Medicare payment rates, they've declined 29% from '01 to '04, or excuse me, from '01 to 2024, when adjusted for inflation and practice costs. So I think it's still, difficult environment for reimbursement, and we'll see what Congress does and if this actually goes through.
You and I did a year-end podcast with just you and me, and then we did it with Blake Madden and Cleet, his dad. And this goes right in line with physicians are right in the crosshairs of some of the cost reductions and some of the financial struggles. This just continues that trend. All right, what's up next? Number 2.
Yeah, that leads, there was a report in medical economics this past month, and it kind of flows right with that. Independent doctors continue to struggle. As you and I know, the independent practices, especially below a certain size, if they're less than call it less than 50 or so, it can be a struggle. You have increasing costs. You have things like we just said, the Medicare reimbursement rates that aren't keeping up with inflation. And then we have the managed care fee schedules as well, which those increases are difficult to come by. And just the differential that small practices get versus large practices is this continuation of that same story.
Yeah, and this report in medical economics that came out that you and I are reading, it talks about the staff shortage and again, that resource deficit that the independent docs are dealing with. So I'd say this is large or small practices, and they're dealing with these major issues with rising employment costs and then just a reduction in the availability of resources. So,
Yeah, and that's why you continue to see the number of employed physicians increasing.
right.
A lot of practices are, let me join a really mega practice, a large practice that has some sort of administrative infrastructure. Let me join a hospital owned or controlled physician practice or private equity, something we talk about a lot. It's actually driven a lot of times out of necessity, not choice.
So let's flip over to disruptors. There's a mid-July article in Health Leaders that hits on some of the disruptors that you and I have been talking about for quite some time. Tell us about that.
Yeah, I mean, this is, the title, this is from Health Leaders. The title of the article is When the Disruptors Are Disrupted, Why
Mhm.
Retailers Are Tapping Out. We had a couple podcasts at the end of last year that really talked about the entrance of retail health, entrance of you had Walgreens, you had Walmart, you had a lot of these sort of retail providers getting into the primary care space. We approached it with some excitement in terms of the way these entities that focus a lot on customer experience, how can they bring that to healthcare? But then here we fast forward a few months later, and we have people like Walmart saying they're closing all of their clinics that were going to be in their practices. You have Walgreens really pulling back on their Village MD strategy, et cetera. And I think it kind of goes down to dollars and cents. Like I always talk about is how can you make money on primary care? And is primary care reimbursed enough to make it sustainable without some sort of ancillary profit stream, without some sort of ancillary service that you're providing? It's just kind of that same story. And it's been interesting to see where that's going and how a lot of fanfare last year, but it seems to be muted. And I know we're going to do a future podcast on this topic alone.
I think our spidey sense was going off back then, even a year or two ago, when some of these new entrants came into the retail health space. You and I had said, hey, healthcare is really hard. And we hope they appreciate that. And so some of this is the shaking out of some of that. So
Yeah.
then moving into something that goes against exactly what you and I just talked about. What about this Humana deal?
Well, you have Humana now. So I just mentioned that Walmart was closing its healthcare clinics, but then it just came out a few days ago that Humana Centerwell they're going to move into 23 of those clinics that are closing. So it's almost like you've got Walmart couldn't figure it out, and so they pulled out, but now Humana, which is someone who knows the space well, they're going to see what they can do, and it may be a good deal because I think Walmart's intention was really just to have foot traffic in their stores and make sure that you capture that foot traffic. But now they're shifting the risk to someone else as far as making the clinics actually run. And I think Humana is probably getting a pretty good deal on this. Our friend Blake in his hospitality newsletter had some thoughts on this as well. That they're probably able to get a pretty good deal, and hopefully it's a win for both parties. And then we'll see how those clinics do. I mean, it still comes down to, is that a place where people want to receive healthcare? And can Humana make it a profitable venture? So we'll TBD.
Yeah, this one to me is a little different from just a pure retail play. This is a follow the dollars and look at the payers taking on more of the health process. And so Humana is taking in that primary care role in a retail setting. And to me, it probably does make sense for Humana because they do understand the complexity of healthcare as opposed to a Walmart or an Amazon or a Walgreens.
Yeah, let's hope it's a win-win for both.
Yeah. Okay. So then shifting there to the FTC and some of their scrutiny, what's going on there?
Yeah, as we've talked a lot about private equity in healthcare, that's a topic that's kind of hot throughout the whole healthcare industry in terms of private equity players entering in and doing roll-ups of physician practices, roll-ups of medical providers. And the FTC has taken a really hard stance and really wants to look at, is this a good for consumers? Is this good for healthcare? They have a comment period where they're really gathering information on the effects of consolidation, effects of what they're deeming anti-competitive practices. That's their words, not ours. And there's a comment period on this, but they have extended the time frame from when you can add these comments.
Mm-hmm.
There was supposed to be a deadline in July, but they've extended that to September. I don't know what this means in terms of, is this good, is this bad? But at least it says they're listening and they're waiting to get more commentary from people, because I know the FTC chair, Linda Kahn, has a pretty hardline stance against private equity in healthcare. And that's really based upon a lot of the comments that she's made and just a lot of the headlines coming out of her office.
Yeah, it feels heavy-handed, but I think the only thing that I do like about it is that under President Biden's administration, the FTC has been very aggressive on blocking deals for competitive complaints. And so what this says is they're an even hand across not only the hospital sector, but also looking at PE deals as well. Whether it's right or wrong, it feels more balanced to me that they're going after everybody in healthcare versus just the hospital deals that we've seen blocked. Now, we have two more stories left, but the one on PE, walk me through that one.
Yeah, so this is interesting. And again, what do the real numbers say about private equity in healthcare? People talk a lot in anecdotes, but our friends at PitchBook have done a study, and basically the question is, private equity's role in healthcare exaggerated? And based on the PitchBook study, they say yes. When you look at the actual data about the scope of private equity's presence in healthcare, it's actually not as large as maybe the discussion is around it.
Right.
A PitchBook study found that private equity backers provide or represent just about 3.3% of the U.S. healthcare ecosystem. So it's 3.3% of revenue. And then year-over-year growth of private equity investment in providers fell below 1% in the first quarter of this year, based on this study.
That's almost a rounding error. You hate to say it. That's very, very small, right?
Yes. I mean, that's much smaller than maybe a lot of the heat that's been generated around our story around what the FTC is looking at.
Right.
The numbers don't bear out quite what maybe the heat is.
Yeah.
And it makes sense when you think about it. When you think about the large multi-site health systems that are in the industry, when you think of some of the really mega players that aren't private equity backed, that are either not-for-profit hospitals, that are either publicly traded entities. I mean, we have a $2 trillion healthcare industry.
Mm-hmm.
It's going to have to take a lot of private equity investment to make a big dent in that number, to have some percentages that are maybe higher than what maybe the discussion and the noise is all about.
Yeah. And we're still seeing a lot of private equity interest in the health space. It's just that they're being very strategic with their investments and a little guarded on what their profitability can be and when their exit can be. So we're seeing that for sure. Okay. Then it leads into our final story on physician ownership of hospitals. So Walk us through that. We work with doctors all over the country. This sounds pretty exciting. What's going on here?
Yeah, so this is a bipartisan bill that was introduced in the House, and it probably has a long way to go before it ever became law, especially nothing will probably happen during an election year, of course. But this is a bill that would allow physician ownership of hospitals in rural areas. As most of our listeners probably know, when the Affordable Care Act was passed, there was a moratorium on new physician ownership of hospitals. And so physicians can't own a new hospital entity. The prior ownership was grandfathered in, but new entities can't be physician owned or have physician ownership. And this this bill would do away with that moratorium if it was a hospital in a rural area. And I think it's back to one of our other topics that we like to talk about is the crisis in rural health and the problems there and how can we expand access. And I think this is another thing, almost like the rural emergency provider designation that came out, recently. This is another tool, hopefully, to incentivize people and incentivize rural healthcare.
Yeah, to me, this is exciting. This is one of those issues that gets people very emotional very quick when we talk about physician ownership in hospitals. It's something that I've been around the majority of my career, but boy, it strikes a lot of hopes and dreams and fears also in most hospitals.
Yeah, I know rural areas have such a hard time attracting providers and just having a physician in town or providers enough coverage in the town. That's a struggle. And so, does this provide some sort of incentive for people to put roots in and invest in the community? Possibly. Right. I still think you're going to be dealing with the same revenue problems, same staffing shortage problems that we see in rural healthcare. And so I think it's maybe a good step forward, but then there's a whole lot that has to happen to actually make it successful.
Yeah, I agree. This is a complex one. Okay. Well, hey, Herd, thanks for going through the top issues with me. We'll do it again soon.